You should still be shielding because although you've had the virus, we've got no proof that you have immunity to it. So you are still in the vulnerable category. This means you're still at risk of catching the virus again, and this time your symptoms may be worse. Please continue to follow the government guidelines on shielding. Your immune system may have still been weakened by the virus. Although you've had the surgery, your coronary arteries haven't been mended, so you still have coronary artery disease. Although your heart valve has been replaced, it's still really important to take care of yourself. So it's therefore really important that you carry on living a healthy lifestyle and take all your medication as prescribed. Most people with a heart condition should be able to enjoy a moderate amount of alcohol. The recommended guidelines are no more than 14 units a week, which you should divide up during the week, so you shouldn't save them all up for one day.
If you are awaiting an investigation or a clinic appointment as an outpatient and it's been cancelled due to coronavirus, your hospital will be contacting you with a rescheduled date for your investigation. In the meantime, it is very important that if you get severe symptoms such as chest pain, you go and get it investigated. So call 999, or if you have somebody to take you along to A&E, please do. And it's important to explain to them that you are awaiting an investigation, such as a CT angiogram, to have a look at your coronary arteries. So if you continue to get symptoms whilst you're waiting, please don't sit on it. Make sure you seek help. And in the meantime, your hospital will be working through a list of patients that they need to reschedule.
You should make an appointment to see your cardiologist or GP. This is more likely to be by telephone consultation due to the COVID crisis. Your medication may need reviewing to help your symptoms and to reduce the strain on your heart. You should work at a pace that suits you and one that you feel comfortable with. It's really important that you warm up and cool down before any kind of activity that you do. If you do too much too quickly, you'll regret it and you'll probably feel pretty worn out for the rest of the day and the days that follow. So that may put you off exercising. So really important to pace yourself.
We know from evidence that people with high blood pressure are at an increased risk from coronavirus. One of the things that we don't know from the evidence is how that applies to people on an individual basis. It may well be that if you have high blood pressure and it's well controlled on medication and you don't have any complications from high blood pressure, such as a thickened heart muscle, that your increased risk might be relatively small compared to somebody who has uncontrolled high blood pressure and does have complications from it. So we do know that you are at an increased risk, but as to how that applies on an individual basis, it's quite difficult to tell. If you have AF, there isn't enough evidence at the moment to be able to tell whether you are at high risk from having an abnormal heart rhythm, but whether that puts you at high risk of having a increased risk from coronavirus. It seems likely that if you have well-controlled atrial fibrillation, that your risk is lower than the groups who would be at higher risk.